I'm incredibly pleased to be on this roundtable. I am the Minister for Innovation, and we do see one of the benefits of this horrible disease is the potential for having a huge inflection point in the adoption of innovation in the healthcare system. And that's what I really want to talk about. And I want to start by saying a really big thank you to everyone who's on this call, everyone who works in digital tech companies, because you have been a massive support to us throughout the pandemic. The NHS has continued to be there for us, and along with clinicians and frontline health staff, a massive credit goes to our digital health partners who have helped. And let me give you a couple of examples. You've helped our patients and citizens connect with health professionals, carers and loved ones, from pledges of smartphones and tablets to video consultation and remote monitoring technologies. And I had a showcase last week, a fantastic app for people who had COVID, where they could put a dongle on the end of their finger and measure the oxygen in their blood, which meant that they could stay at home reassured that should their condition decline, clinicians would be onto it immediately and could call them in if necessary. You've also helped our frontline NHS staff to stay connected and supported, from broadband and phone offers to digital assistance with essential shopping and travel. And you've helped to swiftly find solutions to problems the pandemic poses to our healthcare and well-being through pledges of resources and expertise. So a massive and heartfelt thanks for your efforts, goodwill and ongoing support, as we really couldn't have done it without you. I've seen at first hand the innovation that the private sector working together with the public sector can bring. And the work I've been doing on test and trace is a really good example. I could not have believed in March the rate of innovation that has gone on in testing in terms of speed, accuracy, price and sheer scale of testing. You know, we were doing 2,000 or 3,000 a day, and we're doing 200,000 or 300,000 a day at the moment. And I have in mind that we can see a day when we might do 2 or 3 million a day. I mean, that is an absolutely incredible turnaround, and is all about innovators stepping up to a huge challenge. But I am alive to the changes to the way in which working and culture across the NHS and social care the digital shift has brought. And we need to harness that and bake in the benefits for the long term. As we head into winter, planning for COVID recovery and beyond, I am and I will continue to champion digitisation as a vital part of planning, delivery and personalisation of good care and support right across the NHS and social care. We've learned a lot through COVID, and we need to build on that. We need to increase the use of digital channels, support people to have safe and high quality care where they live, but at the same time address inequalities and digital exclusion and access, and act on the gaps between services so people can have frictionless experiences. As you heard from previous speakers, there are many local examples of real progress and innovation across the country that bring health and social care services more closely together to support those they care for. And the NHS is working with councils, local NHS services, social care sector and industry to connect care providers with the NHS. We are supporting care providers to adopt the infrastructure and technology needed to deliver fast and reliable access to digital health services. And this includes improving unreliable internet connectivity and poor digital infrastructure in care homes and across care providers, to alleviate inequality and missed opportunities, for harnessing digital tools that personalise and improve the direct care of some of our most vulnerable citizens. We have an ambitious task to enable the sharing of care records across health and social care. NHS Mail has rolled out to more than 11,000 care settings, enabling better and safer communication with local health officials. Next, we'll give staff fast access to the accurate and up-to-date information they need to provide safe, informed, direct care and make care and treatment decisions. This will reduce the time burden too, giving staff time back to spend on delivering care. And what about supporting people at home? Here you'll see tech supporting a bolder move to digitally enable personalised healthcare, delivering at the right time in the right place. From online and video consultations to regional scale plans for remote monitoring and virtual wards, supporting many people to manage their care from home wherever they live, especially those with long-term conditions. I'd like to pause a moment to say a few words about the impact of remote monitoring on families. Many of us who have relatives who need expert health advice and would prefer to stay in their own home when they receive this. And I know this from my own personal experience. My auntie Susanna, who lives in Edinburgh, is very passionate about staying in her home in Edinburgh. I have the scars on my back of the battles to try and move her, and she ain't going anywhere. So anything the tech industry can do to support Auntie Susanna is massively appreciated. And the devices and technologies that are being implemented help clinical teams see the results of vital signs of patients and support their care at home. This also gives patients and their families greater knowledge of how they're progressing, and they are aware if they are within expected parameters for their condition. Patients have fed back that it is reassuring to have more information on their condition, to know when the clinical teams have reviewed their results, and that their care will be escalated promptly if needed. I have experience of caring for my elderly relatives, and I know that they'll benefit from remote monitoring of digital services. I'm delighted that practical support from the NHSX team includes establishing procurement routes that make it fast and easy for the NHS and social care to select suitable digital products locally. For example, NHSX has recently developed and published a new clinical communications tool framework that makes it easier for staff, trusts and commissioners to use product solutions and software from a range of approved suppliers that best meet their needs. This is an exciting opportunity for secondary care to enhance multidisciplinary team working. To kickstart the introduction of these modern communications tools, NHSX has secured £3 million to cover some of the licence costs in the first 12 months. And I've just paid personal testimony to everyone involved in that project. It's really valuable, and I know it was a huge amount of work to get going. And in the outpatient setting, we are reimagining care pathways so they are strongly digitally supported, with patients and systems being able to make full use of the advances in digital platforms and devices to receive their care at home, supported by clinical teams who can review their progress. We've started developing digital pathways in cardiology, ophthalmology, dermatology, musculoskeletal, cancer and respiratory care. This is the start of new ways of delivering personalised tech care, supporting people in their homes. I was also delighted that the 42 winners of the first round of the AI in Health and Care Awards were announced last week. AI technologies that have been selected to receive a share of the first £50 million will help personalise NHS screening and treatments for cancer and eye disease, speed up stroke care and turn mobile phones into a monitor to detect irregular heartbeats. Throughout our history, the NHS has led the way in designing, developing and introducing cutting-edge technology. The innovations we're funding have the potential to transform how we deliver services to patients right across the country. The potential of AI is vast, and through the NHS AI Lab, we are accelerating the safe adoption of world-leading data-driven technology that meets the aims of the long-term plan. We've freshly produced an AI buyer's guide for AI in health and social care. You can find it on NHSX's AI Lab web pages. It identifies 10 questions commissioners should consider when looking at adopting AI technology so that they can have more confidence in doing so. There will be further rounds of applications to the AI fund for the hundreds of innovators with ideas which they wish to put into practice in the NHS and in social care. But this is just the start of some of the biggest changes we've seen in health and medical developments in decades. Finally, I'm working to ensure that through global collaboration in areas like cloud-based services, clinical research, data-driven technologies and AI, we provide future opportunities for innovators such as yourselves to operate within a vibrant UK health and care technology industry and to export our services and products around the world. So we're there to help you. We're enormously grateful for the efforts you've made, and I'm really looking forward to the discussion we're about to have. Thank you, Lisa.